I'm Dr. Emma Victoria, and I need you to hear this as if I'm sitting right in front of you, looking you in the eyes, because this is not general health advice and it is not theoretical. This is about your brain, your memories, your ability to speak, to walk, to recognize the people you love. When a stroke begins, you are not having a bad day. You are entering a medical emergency where every single minute permanently changes what your future will look like. Most people imagine a stroke as something dramatic, someone collapsing, unable to move, unable to speak. But that image is dangerous because many strokes begin quietly. A slight numbness, a strange heaviness in one arm, a headache that feels different, a moment of confusion that passes. And this is where lives are lost, not immediately, but slowly, silently, while people wait. I want you to understand something that most people never truly grasp until it's too late. Your brain does not feel pain when it is dying. It doesn't scream. It doesn't warn you loudly. It fades. And during the first few hours of a stroke, that fading can still be stopped or reversed, but only if you act. In the next part, I'm going to explain exactly what is happening inside your brain minute by minute, and why waiting, even when symptoms feel mild, can cost you abilities you will never get back. Right now, stay with me mentally. Not because I want your attention, but because your life or someone you love could depend on this knowledge. When blood flow to the brain is interrupted, brain cells begin to starve. They are deprived of oxygen and glucose, the two things they cannot survive without. Within minutes, cells begin to malfunction. Within an hour, they begin to die. And once a brain cell dies, it does not regenerate. This is not like a muscle or skin. The brain is unforgiving when it comes to time. There are two main types of stroke, and understanding this matters. The most common is ischemic stroke, caused by a clot-blocking blood flow to part of the brain. The second is hemorrhagic stroke, caused by a blood vessel rupturing and bleeding into the brain. In both cases, the clock starts immediately. But with ischemic strokes, that early window is especially critical because clot-busting treatments can sometimes restore blood flow if given early enough. Doctors often call this the golden window. I don't like that term. It sounds optimistic. I prefer the truth. It is a closing door, and once it shuts, the damage becomes permanent. Here is where many people make a fatal mistake. They tell themselves, "Let me lie down, let me drink water, let me wait and see." I have seen patients who waited just 30 minutes too long. 30 minutes. That's the difference between walking out of the hospital and being confined to a wheelchair, between speaking normally and struggling to form words, between recognizing your grandchildren and seeing strangers. You may be thinking, but I would know if I was having a stroke. That belief is one of the most dangerous myths in medicine. The brain can lose function without triggering fear or urgency. In fact, confusion itself is a symptom, which means the very organ you rely on to decide to seek help may already be compromised. Let me speak directly to you now. If you ever experience sudden weakness on one side of your body, even if it's mild, if your face feels uneven when you smile, if your speech becomes slurred, slow, or difficult to find words, if your vision blurs or doubles, if you feel sudden dizziness, imbalance, or confusion, that is not something to monitor. That is something to act on immediately. And yet, people don't, especially older adults, especially those who don't want to make a fuss, especially those who live alone, especially those who have been taught to endure discomfort quietly. I've sat with patients who told me, "I didn't want to bother anyone." I've listened to spouses say, "They said they were fine." I've looked at brain scans where I could see exactly how much function was lost during those hours of waiting. Those moments never leave you as a physician. There is something else I need you to understand, and this is deeply important. The brain controls everything you take for granted, not just movement or speech. It controls swallowing, bladder function, emotional regulation, memory, decision-making, and personality. Some stroke survivors don't lose their ability to walk, but they lose their ability to concentrate, to plan, to feel joy the same way. These are losses that are invisible to others, but devastating to the person experiencing them. This is why the first 4 hours matter so profoundly. During that window, doctors can sometimes administer medications that dissolve clots, reduce inflammation, and protect surrounding brain tissue. Imaging can identify which areas are salvageable. Interventions can limit the size of the damage. But once that window passes, treatment shifts from prevention of damage to management of loss. And I want to be clear, surviving a stroke is not the same as recovering from a stroke. Many people survive and live with consequences every single day. Now, let me ask you something gently but honestly. If this happened to you in the middle of the night, or while you were alone at home, or while you were out running an errand, would you recognize it as an emergency? Or would you minimize it the way so many people do? This is not about fear. This is about preparation. Because when your brain is under attack, you do not rise to the occasion. You fall to the level of your preparation. Another critical truth is that strokes don't always come with pain. Many people assume there will be severe headache or intense discomfort. That's not always the case. Some strokes feel strange rather than painful. Some feel like fatigue. Some feel like clumsiness. That false sense of "this isn't serious" is what steals time. I want to talk about denial for a moment because denial is powerful. The brain protects itself by downplaying danger. It tells you to rest, to wait, to avoid embarrassment. But during a stroke, denial is not protection. It is harm. There is also shame. Some people feel embarrassed calling emergency services. Some worry they'll be told it's nothing. Let me say this as clearly as I can. No doctor, nurse, or paramedic will ever be angry that you acted quickly. We only wish more people did. I need you to hear this as someone who genuinely cares about you as a human being. You are not weak for acting fast. You are not dramatic. You are responsible. You are protecting your future. In the next part, I'm going to walk you through what those first 4 hours actually look like inside the hospital, what doctors are racing against, and why even arriving 10 minutes earlier can change your outcome in ways most people never realize. Before we continue, I want you to do one small thing that could help save lives. In the comments, write which country or city you're watching from, because stroke education needs to reach people everywhere, not just where hospitals are nearby. Now, take a breath with me, and let me explain why the clock your brain is on is far more unforgiving than any clock you've ever watched. When you arrive at a hospital during a suspected stroke, everything changes instantly. The pace is fast, the questions are short, and the urgency is real. Not because doctors enjoy rushing, but because your brain is losing cells every minute. There is a reason stroke teams move the way they do. They are racing against biology. Here's something most people don't realize, and I want to reveal this early because it reframes everything. Doctors are not just trying to save your life, they are trying to save specific parts of your brain: speech centers, memory centers, motor control, emotional regulation. Each region does something different, and each minute determines which parts survive. In the very first moments after you arrive, imaging is done, usually a CT scan. This is not routine. This scan answers one critical question. Is this a clot or a bleed? Because the treatment pathways are completely different, and every second spent before that scan matters. Now, here is the part that surprises many families. The brain damage is not uniform. There is a core area that is already severely injured, and surrounding it is tissue that is struggling but still alive. Doctors call this the penumbra. This area can be saved, but only if blood flow is restored quickly enough. This is why those first 4 hours are not arbitrary. They are based on how long brain tissue can survive in a half-alive state. If the stroke is ischemic, caused by a clot, there may be an opportunity to give a clot-dissolving medication. This medication does not work after a certain time, because once the tissue is dead, restoring blood flow won't bring it back. That window is why waiting at home, even for just a little while, can silently eliminate options. And I want to speak directly to something I see again and again. People think, I'll wait to see if it gets worse. But during a stroke, worse does not always feel dramatic. Sometimes it feels like nothing at all. The damage happens whether you feel it or not. Inside the hospital, while you're lying still, your doctors are calculating time. not just when symptoms started, but when you were last known to be well. If you woke up with symptoms, the clock starts from the last moment you were normal. This is why strokes that happen during sleep are so dangerous. Time slips away silently. Now, let me tell you something deeply human and deeply painful. I have seen patients arrive minutes too late, and I've seen the look on their faces when they're told the treatment window has closed. No one cries loudly in those moments. It's quiet, heavy, because everyone in the room understands what that means for the rest of that person's life. This is why acting early is not panic. It is precision. Another critical reality is this: stroke symptoms can improve temporarily, and that improvement can fool you. Blood flow may partially restore for a moment, speech may clear, weakness may lessen, and people think, see, I'm fine. But what's actually happening is instability. The clot can reblock, the damage can continue, and when it returns, it often returns more aggressively. I want you to hear this clearly, especially if you're over 50. Temporary improvement does not mean safety. It often means urgency. Inside those first hours, doctors are also managing blood pressure, oxygen levels, blood sugar, and temperature, because all of these affect how much brain tissue survives. Even small physiological stresses can worsen damage. This is why home remedies, rest, or sleeping it off are not neutral decisions. They remove you from an environment where your brain is being actively protected. Now, let me speak to the emotional side, because strokes don't just injure the brain, they fracture identity. People fear becoming a burden. They fear losing independence. They fear not recognizing themselves. And that fear is often what makes them hesitate. If that thought has ever crossed your mind, I don't want to bother anyone. I want you to know this: the people who love you would rather be bothered than lose you piece by piece. Another important truth: strokes don't just happen to sick people. They happen to people who were functioning yesterday, people who walked, talked, drove, cooked, laughed. That's what makes them so devastating, and why preparedness matters more than optimism. Let me also address something quietly dangerous: embarrassment, slurred speech, facial drooping, confusion. These symptoms make people feel exposed, vulnerable. Some even feel ashamed. Please hear me when I say this. There is no dignity in silence during a stroke. There is dignity in survival. Now, here's something I want to reveal in this section to keep you thinking ahead. In the next part, we are going to talk about the warning signs that happen hours or even days before a major stroke, signs most people dismiss as nothing, but which are actually your body begging you to act early. Before we get there, I want to ground this in something practical and personal. Imagine two futures. In one, you act immediately. You arrive early. Options are available. Damage is limited. Recovery is possible. In the other, you wait, you delay, you hope, and the same body now faces months or years of rehabilitation, loss, and adjustment. This is not exaggeration. This is the reality I see every week. And I want you to know something else that matters. Stroke recovery is not just physical. Emotional changes are common: depression, anxiety, personality shifts. These are not failures. They are consequences of brain injury. And many of them are less severe when intervention is early. So if you remember nothing else from this part, remember this: speed preserves self. The faster you act, the more of you remains intact. Here is the one thing I want you to do right now, just one sentence. In the comments, write, "I will act fast," if you promise yourself that you will never wait when stroke symptoms appear. Now, let me take you into the next critical discussion: how subtle early warning signs often show up before a devastating stroke, and why recognizing them could prevent everything we've just talked about. This is where many lives could be changed, because a stroke rarely comes completely unannounced. The body whispers before it screams. The problem is that most people don't know how to listen. Here is what I want to reveal early, because it changes how you see everything we've discussed so far. Many devastating strokes are preceded by smaller, temporary events that people dismiss as stress, fatigue, low blood sugar, or just aging. These events are not harmless. They are rehearsals. And when they're ignored, the final performance is often catastrophic. One of the most common early warnings is something called a transient ischemic attack, often referred to as a mini stroke. I dislike that term because it minimizes the danger. There is nothing mini about a warning that your brain's blood supply was briefly interrupted. What makes it deceptive is that the symptoms may disappear within minutes or hours. A sudden episode of slurred speech that clears, a brief weakness in one arm, a moment of confusion where words don't come easily, temporary vision loss in one eye, a sudden inability to balance that resolves after sitting down. These moments convince people everything is fine, but medically they are a red alert. When these symptoms pass, people feel relieved. They tell themselves it was nothing. They move on. But what they don't realize is that the risk of a major stroke is highest in the days immediately following these events. The danger doesn't pass. It intensifies. Another warning sign is a new, unusual headache, especially one that feels different from anything you've had before. Not just pain, but pressure, a heaviness, a sense that something is wrong. Many people treat this with rest or medication and never mention it to anyone. That silence can be costly. Then there is sudden, unexplained fatigue, the kind that feels heavy, not sleepy. The kind where your body feels slow, your thoughts feel foggy, and even simple tasks feel effortful. This is especially concerning when it appears abruptly and without a clear cause. I want to talk about vision for a moment, because this is often ignored. Blurred vision, double vision, or sudden loss of vision in one eye, even if it lasts only seconds, is not an eye problem until proven otherwise. It can be a brain circulation problem. Vision changes are one of the most underreported stroke warnings because people assume they'll resolve on their own. Speech changes are another subtle sign. Not complete inability to speak, but difficulty finding words, saying the wrong word, or feeling like your tongue isn't cooperating. If this happens suddenly, even briefly, it matters. Now let me address something deeply emotional and deeply human. People often hide these symptoms from their families. They don't want to worry anyone. They don't want to seem fragile. They don't want to admit vulnerability. If that sounds like you, I want you to hear this with care. Silence protects no one. It only delays help. I've had patients tell me, after a major stroke, I felt something days before, but I didn't say anything. That sentence is devastating because it carries regret that no one should have to live with. There is also a dangerous belief that if symptoms go away, the threat is gone. That belief is false. Temporary symptoms often mean unstable blood flow, and instability is exactly what leads to larger, more destructive strokes. Let me be very clear and very direct with you now. If you ever experience sudden neurological symptoms, even if they last only a few minutes, that is not a wait-and-see situation. That is a medical evaluation situation. Acting early could mean the difference between prevention and tragedy. And I want you to understand something that may bring comfort rather than fear. Early action does not mean something bad will definitely happen. It means you are giving doctors the chance to stop it from happening. That is power. That is protection. There is one more warning sign that people almost never connect to stroke risk: sudden emotional changes, unexplained anxiety, sudden irritability, a feeling of doom without a clear reason. These can be signs that certain brain regions are not getting adequate blood flow. The brain doesn't just control movement, it controls emotion. If any of this feels personal, that's because it is meant to be. I am not speaking in generalities. I am speaking to you about your body, your life, your future. Here is the one thing I want you to do in this part, just one sentence. In the comments, write, "I will not ignore the signs if you promise yourself you will speak up and seek help the moment something feels wrong." In the next part, I'm going to talk about why people hesitate even when they recognize the signs, and how fear, pride, and misinformation quietly delay life-saving decisions, sometimes by just enough time to change everything. It's why people hesitate, even when they know something is wrong. This is one of the hardest truths I've learned as a physician. Most strokes don't cause damage because people lack access to hospitals. They cause damage because people delay the decision to seek help. And that delay is rarely about ignorance. It's about fear, pride, confusion, and emotional habits built over a lifetime. Let me speak to you directly because if you're over 50, some of these thoughts may already feel familiar. The first reason people hesitate is minimization. The brain is incredibly good at talking itself out of danger. It says, "It's probably just stress. It will pass. I slept badly. I don't want to overreact." And here is the cruel irony. The same brain that is being injured is the one deciding whether to get help. That means judgment is already compromised. You are asking a struggling organ to make a life-saving decision for itself. Another powerful reason is not wanting to be a burden. I hear this all the time, especially from older adults. I didn't want to wake my spouse. I didn't want to bother my children. I didn't want to call an ambulance for nothing. Please let me say this as clearly and gently as I can. You are never a burden for protecting your life. The people who love you would give anything to be bothered rather than lose you or watch you lose your independence. Then there is fear of hospitals, fear of bad news, fear of loss of control, fear of being told something is seriously wrong. Many people would rather sit with uncertainty at home than face certainty in a medical setting, but avoiding information does not prevent reality. It only delays response. There is also embarrassment, and this one is deeply underestimated. Slurred speech, facial drooping, confusion, needing help. These things make adults feel exposed, vulnerable, ashamed. Some people would rather suffer privately than risk being seen in that state. But here is something I want you to truly understand. There is no dignity in delayed care during a stroke. There is dignity in survival and recovery. Strength is not silence. Strength is action. Another reason people hesitate is past experience. Maybe you've gone to the doctor before and were told, "Everything is fine." Maybe you felt dismissed. Maybe nothing serious came of it. And your brain learned a dangerous lesson. This probably won't be serious either. But strokes are not predictable like that. They are not consistent. They do not announce themselves the same way twice. A mild episode once does not guarantee a mild outcome next time. I want to talk about living alone for a moment because this is critical. People who live alone are at much higher risk of delayed stroke treatment, not because they don't care, but because there is no one to witness the change. No one to say, "You don't look right." No one to insist. If you live alone, I want you to hear this as a form of care. You must decide in advance that you will not negotiate with symptoms. You will not debate. You will not wait. You will act. Now here's something I need to reveal in this part to keep you thinking ahead. Many people believe the danger window ends after a few hours. It does not. Secondary brain injury can continue for days if blood pressure, oxygen, glucose, and inflammation are not managed properly. Early hesitation doesn't just affect treatment, it affects everything that follows. There is also the issue of pride. Being independent for decades trains people to rely on themselves, to push through, to endure. That mindset can be admirable, but during a stroke, it becomes dangerous. A stroke is not something you push through. It is something you interrupt. Let me tell you something from experience. The patients who do best are not the toughest or the most stoic. They are the ones who act early and accept help quickly. That single trait changes outcomes more than age, wealth, or even baseline health. I also want to address family dynamics. Sometimes it's not the patient who delays, it's the people around them. A spouse who says, "Let's wait a bit." A child who says, "You seem okay now." This is why education matters for everyone, not just the person at risk. If someone near you ever shows sudden neurological changes, your role is not to reassure them. Your role is to protect them, even if it makes them uncomfortable in the moment. Emotionally, I want to acknowledge something. Strokes steal certainty. They force people to confront vulnerability, and that is terrifying. But avoiding that fear does not protect you from loss. It only removes your chance to prevent it. If there is one emotional shift I want you to make after this part, it is this. Decide now that your life is worth immediate action. Decide that hesitation is not humility. It is risk. Here's the one thing I want you to do in this part, just one sentence. In the comments, write, "I choose action," if you promise yourself that fear, pride, or hesitation will never delay you from seeking help. In the final part, I'm going to speak directly to you about what to do, clearly, simply, and without hesitation, the moment you suspect a stroke, so that when the moment comes, you don't have to think. You just act. This is where everything we've talked about comes together, not as theory, not as education, but as a promise you make to yourself. I want you to imagine something with me for a moment. Not to frighten you, but to prepare you. Imagine it's a normal day, nothing dramatic. You wake up, go about your routine. Maybe you're making tea, or sitting quietly, or talking to someone you love, and then something feels off. Not pain, not panic, just wrong. A word doesn't come out right. Your arm feels heavy. The room feels tilted. Or your thoughts feel slower than they should. This is the moment that decides everything. Not the hospital, not the doctor, not the medication. This moment. So let me walk you through exactly what to do, step by step. Because when fear hits, the brain looks for clarity. First, the instant you notice sudden neurological change, you stop negotiating. No waiting to see if it passes. No sitting down to rest. No finishing what you were doing. Strokes do not reward patience. They punish it. Second, you say it out loud, even if you're alone, even if it feels strange. Saying it activates action. This could be a stroke. Those words matter. They cut through denial. Third, and this is critical, you call emergency services immediately, not your doctor, not a family member first, not a neighbor. Emergency services are trained to recognize stroke, prioritize you, and take you to the right facility. Driving yourself or being driven wastes precious time. If you are with someone who may be having a stroke, you do not ask permission. You do not debate. You act. They may resist. They may minimize. You protect them anyway. Now listen carefully to this next part, because this is something many people don't realize until it's too late. Every minute during a stroke, nearly 2 million brain cells can die. This isn't poetic language. This is measurable, observable damage. Time is not just important, it is the treatment. When you arrive at the hospital early enough, doctors can stop or reverse damage. When you arrive late, we are often forced into damage control. And that difference determines whether someone walks out of the hospital or learns to live a different life. I want to talk to you emotionally now, not clinically. A stroke doesn't just affect the body, it affects identity, independence, confidence, relationships, the ability to read, to speak, to drive, to recognize faces, to live without assistance. I have seen people grieve abilities they never imagined losing, not because help wasn't available, but because help came too late. And I have also seen something else. I have seen people who acted fast, who felt fear and acted anyway, walk back into their lives with gratitude instead of regret. You deserve that chance. You deserve mornings where your mind is clear. You deserve conversations without struggle. You deserve your independence for as long as possible. And that is why preparation matters more than optimism. Here is something deeply important I want to leave you with. You do not rise to the occasion during a medical emergency. You fall to the level of your preparation. The decision you make now while you are calm is the one that saves you later. So decide this now. If it feels sudden, if it affects speech, face, arm, vision, balance, or thinking, if it feels wrong in a way you cannot explain, you act immediately. No guilt, no shame, no hesitation. And here is the one and only thing I ask you to do in this final part, just one sentence. If this message helped you feel more prepared, share it with one person you care about. Because this knowledge saves lives. I care about your future. I care about your clarity, your independence, your time. And if this message reaches you before you ever need it, then it has done its job. Be prepared, be brave, and choose action every time.